so much for joining us for the Engaging in Grassroots Advocacy webinar. So, as I said, my name is Shelby Berger. I'm the Manager of Policy and Advocacy here at the Cancer Support Community, and I'm also going to be joined today by Lannia Stenz, who is the ED of the Gilda's Club affiliate in Madison, Wisconsin. So she's going to talk a little bit later about her experience in advocacy in Madison. So, before we start, just a brief overview for anybody on the call who may not be familiar with the organization. The Cancer Support Community is the largest nonprofit network of cancer support worldwide. So CSC, along with our Gilda's Club affiliates, is dedicated to ensuring that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by community, which we promote through our three-legged stool approach. So we have the first leg, which is our direct service delivery through our CSC and Gilda's Club affiliates. So we have brick-and-mortar affiliate locations across the country, including Gilda's Club Madison, where cancer patients and their families can come and receive emotional support, psychosocial care through our support groups, financial counseling, yoga, cooking, and art classes, as well as a wide range of educational materials. The second leg is our Research and Training Institute in Philadelphia, which is the very first institute dedicated to cancer-related psychosocial, behavioral, and survivorship research. And the RTI also runs our Cancer Experience Registry, which is this really amazing, unique online community that allows people facing cancer to share their experiences, identify issues, and participate in surveys. And so then the third leg of the stool, where I work here in Washington, D.C., is the Cancer Policy Institute. So at the Cancer Policy Institute, we work to bring together patient advocates with policy experts to elevate the patient voice and ensure that their needs play a central role in federal and state legislative, regulatory, and executive policy making. So we utilize leading-edge data that we get from our Research and Training Institute to support our policy positions with evidence that is based in the patient experience. And then the CPI also engages in advocacy powered by a grassroots network of thousands of advocates across the country and through our online platform where we provide updates on policy issues that could have an impact on the health and well-being of cancer patients and survivors and offer opportunities for advocates to make their voices heard with federal and state policymakers. So our plan for today is to really walk you through grassroots advocacy from the very beginning. So we're going to start with what is grassroots advocacy, and then we'll move on to who can engage in advocacy, how does it work, and share some examples of how CSC is already active in advocacy, and then finally share ways that you can be an advocate on behalf of yourself, cancer patients, and anyone impacted by cancer. So let's start with a general overview. Advocacy is defined as the public support for or recommendation of a particular cause or policy. But grassroots advocacy really relies entirely on the power of the general public rather than the work of high-powered lobbyists. Policy movements begin with everyday citizens engaging in a cause, educating their friends and neighbors, collectively educating legislators and policymakers, and finally informing policy outcomes. So you don't need money to engage in grassroots advocacy. You just need passion about a cause and the courage to speak up about it. I'm sure everyone's well aware with the First Amendment of the U.S. Constitution, but the First Amendment really solidified the rights of all people to speak freely about issues or their concerns for the operation of their government. As we're all aware, we live in a democracy which ensures that our government is of the people, by the people, and for the people, and we elect our representatives from our local councilmen to our state legislators or our members of Congress to represent us at every level of government and to raise the questions and suggest solutions for those issues which we see impacting our lives. But of course, unfortunately, these elected representatives can't be everywhere or be well informed on every single issue, and so that's where it becomes our job to educate and draw attention to the problems that we want to see fixed. And that's really what advocacy is all about. So, who can participate in advocacy? Anybody. You have the right to contact your elected officials and share your opinions and stances on certain issues. There's no special training or advanced education required. We all can be advocates, and all you need is passion and dedication to learn about your issue and to share it with everyone you know. Really small actions can make really big changes, and all it takes is for one person to decide to speak up. So let's start at the beginning and go over the basics of how the government operates. As I'm sure everyone knows, there are three branches of government. So the legislative branch, which enacts legislation, confirms or rejects presidential appointments, and has the authority to declare war. So this includes our Congress, which is made up of the United States House and the United States Senate. The executive branch carries out and enforces laws. That includes the president, the vice president, cabinet members, executive departments, federal agencies, and other boards, commissions, and committees. And the third branch is the judicial branch, which interprets the meaning of laws, applies laws to individual cases, and decides if laws violate the Constitution. So the Supreme Court is the highest court in the land, and there are other federal courts across the country. State government operates in very much the same way that federal government does. The legislative branch enacts legislation, it creates state budget priorities, and initiates tax legislation. So in most states, the legislative branch is made up of the state-level House of Representatives and the state-level Senate. The executive branch carries out and enforces the laws. At the state level, that includes the governor, the lieutenant governor, and the cabinet members. And the judicial branch interprets the meanings of the laws, applies the laws to individual cases, and decides if laws violate the state constitution. So that includes the state Supreme Court and the lower level courts. So now we'll dive a little bit deeper into the legislative process and talk specifically about the process in which a legislator introduces a bill and it can one day become a law. As I mentioned earlier, legislators and their staff cannot possibly be experts in every area. So for this reason, many bills begin with an organization, a group, or an individual who identifies an issue and a solution and brings it to a member for support. So that's not always the case. Many legislators have legislation that they work to create on their own or as part of campaign promises. But for the sake of this example, let's say that we're working as part of a coalition of organizations that want there to be a law requiring that social and emotional services be provided to every cancer patient going through treatment. So the first step of this process would be to gather all the necessary information, statistics, fact sheets, and support to present to the legislator. Some groups can create their own bill language, though the legislator can also draft it themselves. Once we have a member who agrees to be the sponsor of the legislation, they'll introduce it into their chamber, House or Senate. So for this example, let's say that our legislation is being introduced by our fictional friend, Representative Brown. So once introduced, the bill will be given a number and assigned to a committee best equipped to handle it. So in this fictional situation, let's say that our bill is House Bill 1, and it's been assigned to the Health Committee. The members of the committee will discuss the bill, hold hearings, propose changes to its language, and ultimately must vote on it favorably. Once it has passed out of the committee, it moves to the full House chamber. So the bill is discussed again, members can offer changes, and ultimately, once again, it has to be voted on favorably by the entire chamber, so every member of the House. If it receives a majority of yes votes, it moves on to the other chamber. So in our example, it would move to the Senate to start the process over again. The bill retains its original number, so House Bill 1, and begins the process again. It's assigned to the relevant committee who, again, hold hearings, propose changes, and ultimately must vote favorably on its passage. Once the bill passes the committee, it goes to the full Senate chamber to be debated, amended, and ultimately passed. Now, it is important to note that if the version of the bill passed by the second chamber, in our case the Senate, does not match that of the first, the House, it goes to conference committee, which is made up of members of both the House and the Senate to reconcile the differences. So the House and Senate must vote to pass the final legislation of the bill before it goes to the president or governor at the state level. The president or governor then must either sign it into law, veto it, which means that he or she has rejected the bill, or pocket veto, which is when the president or the governor does not sign it nor veto it and simply leaves it to expire. But it's important to note that vetoes can be overridden by a 2/3 majority vote, so just because the president or the governor has vetoed a bill doesn't always mean that it can't pass. But this process can be very different and vastly more complex depending on the legislation, but this is the general mechanism through which an idea can become a bill that becomes a law. So let's talk a little bit about the state and federal government and some of the differences. As we all know, the federal government is made up of our Congress, which is a full-time legislature. There are 435 representatives, 100 senators, and the president signs laws. At the state level, there are 50 legislatures, but a lot of them are a little different. So some are full-time, some are part-time, some are hybrid. They meet for a short period of time every 2 years. It can range from 49 members to 424 members. Most are bicameral, and the governors can sign laws. But the important powers to note are that the federal government maintains the military, declares war, and it interacts with foreign governments and can coin money. The state government establishes local governments, it sets up schools, and it regulates state commerce. But they both collect taxes, establish courts, regulate commerce, and provide for general welfare. The party in control of the governing body also has a lot of power and influence in what kind of laws are passed. So currently the U.S. Congress is controlled by the Republican Party, and you can see from this map, at the state level, Republicans control 67 legislative chambers, and Democrats control 31 legislative chambers. Moving on to advocacy. There are many, many ways to be an advocate, and advocacy happens in big and small ways at various levels. So advocacy is not only just asking for legislative action, but you can also engage in advocacy within your community, by engaging the media, by promoting certain policy issues and priorities, contributing to or commenting on regulatory decisions, and by educating and advocating for yourself. How does it work? Well, first and foremost, if you want to get involved in advocacy, you should identify 1 to 2 issues maximum. It's always going to be more effective to focus your efforts on 1 or 2 issues rather than spreading yourself too thin. Next, you're going to want to identify your target audience. So if it's an official, know who your elected officials are and what they care about. Identify those in your community who you can inspire and work together. Know your audience. Next, you're going to want to educate yourself about the issue. So read articles, gather statistics, talk to others who are impacted by the issue, and don't assume that the elected official or staff already understand your issue because you're the expert. Next, with that information, you want to prepare a position. So the more you know about your issue, the more you can speak from experience and state a clear position. Set your objectives. If your objective is simply to get your community more informed about an issue, great. Perhaps you want to send 20 letters to a member or gather 5 people who can attend a town hall to talk about the issue. But you also need to identify your goal. Do you want to see a bill passed? Do you want regulation change? Make sure that your objectives are helping you achieve that goal. Next, what is your solution? If not enough cancer patients are receiving social and emotional support during treatment, how are you going to change that? What are you suggesting that your community or legislator do? Make sure that you really develop a clear situation. Next, take action. Schedule meetings, attend town halls, send letters, make calls, ask for something specific like a vote for a bill, co-sponsor a bill, introduce a bill, write a letter of support, host a briefing, and then make sure that you follow up on those asks. And then finally, don't give up. Sometimes it can take so many years to pass a bill or change the opinion of the public on something, but you have to keep working, keep gathering information and sharing stories and building relationships, because every small action that you take does really have a direct impact on those policy outcomes. Just some examples of grassroots advocacy. Obviously, there are unlimited ways that you can engage in grassroots advocacy, but some examples would be writing a letter or meeting with your elected official. You could attend a lobby day, testify in a committee hearing, write an op-ed, volunteer on a campaign, tweet or tag on Facebook or tag on Instagram at your elected officials, attend a town hall, building relationships, and really importantly, voting. So, why sharing your story matters. Really, the most important thing that you can do when engaging in advocacy is to share your story, because you're an expert on your issue. Your ability to tell your story puts a face on the issue, and your personal experience is so impactful and meaningful, it's really the best way to educate anyone about your disease, your issue, and your concerns. So the pictures on this slide show some of our CSC and Gilda's Club affiliate leaders visiting with their members of Congress recently to share their personal experience and the real concerns of members that come through their door every day. I mean, elected officials truly want to hear from you, from their constituents, about why those issues are so important. Sometimes it can be overwhelming, but it's important that you share your story the right way. Elected officials do truly want to hear from their constituents about the issues that they're facing. So when you go to share your story, you want to make sure that you talk about your experience, make it personal, and really describe the impact that it has on you and your family. And then finally, be very clear in explaining what that legislator can do to help. Just a little note on the importance of grassroots advocacy. I think a lot of times when we think about grassroots advocacy and all of these small actions like tweeting at our legislator or sending a letter, you know, it might feel like that's not very effective or like your legislator doesn't care or doesn't pay attention to that. But this chart really shows that that's not the case. So this chart is the result of a study in which researchers asked senior staffers what kind of communications are most effective in influencing the decision of the policymaker. And you can see from some of these statistics we pulled out on the side, 97% of the sample agreed that in-person visits have influence. 88% agreed that individualized emails have influence. And 86% agree that phone calls make a difference. So this is really tying back into the fact that sharing your story is the most important and influential thing that you can do. If you go visit with your member or you make a call or you write an email and you take the time to share your story and share why it's important to you, that's valuable and that's impactful. All of these actions really have a real impact on policy outcomes. Like I said, your voice is important, so if there are issues that you want to change, whether you want to see a world with more comprehensive healthcare coverage or you want to make sure that there are snacks available at your support group meetings, you are really the person who has to stand up and make that happen. Another great way to get involved in advocacy is to find ways in which you can partner with other groups or people or organizations. So if you know there's an issue that you want to work on, look to see if another group or coalition is already working on that issue and see how you can get involved, or attend meetings in your town or in your city where the issues are being discussed so that you can learn and share your own experiences and concerns. You can join email lists and Facebook groups. You can follow Twitter accounts and share your experience and your information with other groups so that you can connect and work collaboratively. It doesn't always have to be just you. So, just some last tips when thinking about meeting with elected officials or interacting with your elected officials. As I mentioned before, elected officials work for their constituents. So they are elected to represent you and they care to hear what you have to say, what's impacting your life. Staff are not experts on every issue, neither is the member, so never feel like they're not going to appreciate what you have to say because it's your issue and your experience, not theirs. Elected officials are just people. Sometimes I think it can be easy to think of them as celebrities or someone frightening or someone who really looks down on you, but an elected official is just an everyday person who is just trying to do their job and represent you to the best of their ability. So know where to focus your efforts. Don't forget about district offices when you're meeting with members of Congress. If you meet in district, you can meet with their staff members who might better know your area, better know your issue. Always try to be brief and respectful. Never get angry or yell at a member or a staff member because you attract more flies with honey than vinegar. Prepare both your personal stories and your data. Offer those solutions, and then finally, always thank them because, as we mentioned before, they're working for you, and they're there to represent your issues, and we should appreciate that. So moving on from that, just a little aside about really the importance of social media. I think, as I mentioned before, a lot of times it can seem like just tweeting at a legislator or tagging them on Facebook or sending them a Facebook message might not be valuable, but social media, especially in this day and age, is a really effective way to get your officials involved and keep them up to date. So a lot of them actually monitor their social media accounts regularly, and they'll respond to your Facebook messages or they'll tweet back at you and take notice of your efforts. So never think that using social media is a waste of your time. This is just an example. Recently, as I mentioned earlier, a lot of our affiliate leaders went and met with members of Congress, and we had a great meeting with Senator Baldwin and tweeted at her, and she quote tweeted us and thanked us for the incredible work that we were doing, and that was a great reaction because we knew that she took notice, that she appreciated that meeting, and then she shared that meeting with her followers so that anybody who might be following her might notice Gilda's Club Madison and wonder what they do and look into us and really be able to see the impact of that across the board. So, moving on to how you can get involved. We're just going to go through 2 really quick case studies, examples of ways that you can easily get involved. This is first kind of a fictional scenario. So just to walk you through the process, let's imagine that we're back in the summer and members of Congress are trying to repeal the ACA, which includes those protections that ensure that health insurance companies can't deny you health insurance for a pre-existing condition. And obviously, we know as cancer patient advocates that this is a huge issue because patients and survivors need access to that affordable and quality health insurance and shouldn't be denied just because they had cancer or have cancer. So we're going to take action, and some of the things that we can do, we can educate our members on why they can't repeal those protections, send them emails and letters and call them and tweet at them, and impress upon them how important these protections are to cancer patients and cancer survivors. You can tweet at them, tag them on Facebook, attend their local town hall meetings and rally events, and stand up and explain why this is so important to you and the community that you represent. And then finally, we can witness a policy outcome. So just like we saw this summer, the cancer policy community and really just the health community in general really got up in arms and said that repealing this protection is not okay. And ultimately it failed because members of Congress heard our desires and heard our concerns and acted accordingly. This is a case study that's a little more in-depth on the state level. So step therapy, or fail first, is something that the cancer support community and Gilda's Club have been active in this year at the state level. So step therapy essentially is a tool used by insurers to limit spending on patients' medications. So under step therapy protocols, patients have to try 1 or more drugs chosen by their insurer that might be, deemed lower cost before and fail them or prove that they did not work before they're granted coverage for the higher cost medication, which in a lot of cases is what the patient's provider wanted them to be on in the first place. So this is a big problem because there's been a dramatic increase in the use of these protocols since 1993. As it says on the slide, in 2010, nearly 60% of commercial insurers were using step therapy, and 75% of large employers reported offering employee plans that utilize step therapy. So this is a protocol that's really impacting patients across the board. And it's not just cancer patients. It's also patients with Alzheimer's disease, autoimmune diseases, diabetes, epilepsy, glaucoma, hemophilia, HIV and AIDS, or mental health. So this is a really important issue. So the impact on patients, obviously, step therapy causes delays in access to care, lower quality of care, increased overall costs. It can put patients at risk if they're asked to try and fail of medication that their provider may not have chosen in the first place, and then oftentimes can lead to setbacks and progression of a disease. So the solution, CSC and Gilda's Club work with state-level coalitions across the country to advocate for and promote legislation that creates patient safety measures within step therapy protocols. So the legislation requires that step therapy protocols must be based in clinical evidence. It establishes an exceptions and appeals process that must be transparent and accessible for patients, and requires that insurers get back to patients within 24 hours with the response so that patients are not experiencing those delays in access to care or setbacks in their treatment or recovery. And this has been a really successful campaign. As you can see from this map, there are 15 states where step therapy laws the laws that I just described have been enacted, as well as 8 states where those laws are pending and going through the committee process. So that's all due to the work of the cancer support community and the Gilda's Clubs being involved in coalitions, writing letters, calling those legislators, attending committee hearings, and explaining why this legislation is so important, why it impacts our patients, and why they should make a change. This is just a little example. In Ohio in September, we attended a Ohio Step Therapy Advocacy Day along with the CSC Central Ohio members. We had our program director and our outreach coordinator come, and we met with representatives, and we talked about the importance of step therapy. And at the end of that, there was a huge influx in co-sponsors on the legislation and articles in the newspaper, and a great response across Ohio in the importance of this legislation. So it's a great way to show just how impactful something like this can be. So right now I'm going to turn it over to Lannia, our ED in Madison, who can talk a little more about what they do at Gilda's Club Madison and the great advocacy work that they've been doing. So over to you, Lannia.
Thank you. Can you hear me?
Yes, ma'am, we can.
Fantastic. Thank you. So for those of you who are not aware, Gilda's Club Madison is one of the local affiliates of the cancer support community. We provide emotional support, cancer education, and hope to children and adults with any kind of cancer and those who care for them. We have about 3,500 members that we work with. And so when we have the opportunity to reach out to our legislators, it's a fantastic opportunity for us to represent the folks that we see every day that are dealing with cancer. When I first visited with a legislator about 10 years ago, I will say that it was nerve-wracking. And when Shelby says something like, these are real folks, I want you to hear her. When we've had legislators come to our clubhouse and, meet with members, one of the things that we see is that they truly want to hear from their constituents. Cancer affects almost everyone. And when we're coming together to try to ensure that people are getting the best care possible, our legislators want to hear from not only the people who are living with cancer, but their caregivers and the folks who are out there supporting them at organizations like Gilda's Club and other groups. So when you reach out to your legislator, first of all, everything that I have read has said, call, don't email. The very first best option is that face-to-face meeting where you can truly sit down with your legislator and have a real conversation with them. If you cannot visit with them in person, I strongly suggest you call them. And as Shelby said, if you need to email, write a very personalized email. The reason why I suggest calling is that when a legislator receives a call from a constituent about a specific topic, they'll often be notified right away, bringing that topic immediately to their attention at that time. Whereas emails, they may get hundreds or even thousands of emails, depending upon what kind of vote is coming up, and it may not even be looked at until much later, or it may be being looked at by staffers that may not be notifying right away what is coming through in email. Regarding face-to-face meetings, when you have the opportunity to visit with your legislator, I will reiterate here again, stories matter. Because so many of us are touched by cancer, there is the potential that you can sway someone on the other side of the aisle from yourself if you tell a compelling individual story. When you have a very specific ask for your legislator, whether it's regarding a piece of legislation coming up or something that you specifically want them to keep in mind when they're making decisions, making sure that your story ties directly into that is important. If you are a person who is working for a nonprofit, a hospital, an organization, bringing someone along with you that has a specific personal story that they can speak to is going to be more compelling than even what your stories would be as a staff member or employee of an organization or hospital. But being able to share that story in a compelling manner, but being brief and concise at the same time, always a challenge. Making sure that before you walk in the door that you have a specific ask for your legislator, whether it's a vote on legislation or something else, keeping to your point, discussing one issue or, as Shelby said, one or two issues, preparing a one-page fact sheet that you're leaving behind, being aware of what committees your legislator is active on and whether or not they will have a say in things as they're coming down the pipe. Be aware that the Grassroots Network can actually be helpful to you in the preparation of that data that you leave behind. It's part of why they're in existence, so that they can help us be more concise and make the asks that really matter. From a personal standpoint, it was really an honor to meet with my legislators not too long back. You see the picture there of us with Tammy Baldwin. We met with a couple of others. And whether you meet directly with the legislator or their staffer, it's valuable. Sometimes you'll actually get more attention from the staffer than you will from the legislator themselves. So don't feel like you've been shuffled off to someone that isn't going to hear you just because you met with a staffer. In fact, it may be that that's the staffer who is specifically addressing health issues with their legislator, and they may actually be able to have a greater impact depending upon what their role is within the staff. I think that is it from me. Keep in mind that because cancer affects everyone, your story does matter. And if you do reach out and you talk to a staffer, know that your comments are going into most likely a spreadsheet that will bring your topic to top of mind with your legislator in the coming days. So make sure that you are being brief and concise, keeping on point, and sharing those emotional stories.
Great. Well, thanks so much, Lannia. I think that was a great kind of exploration into your experience, and you had some great tips for us on how to attend those meetings and how best to get the attention and what to keep an eye out for and what not to worry about. So I really appreciate everything that you've shared. So just a few more things. I just wanted to go over how can the Cancer Policy Institute support you. So if you're someone who is interested in getting involved in grassroots advocacy, whether you work for an affiliate or you're a member or you're just you're a cancer patient or someone whose family member has cancer or anybody who is interested in becoming involved in advocacy, we are launching a brand new website, an advocacy tool that will happen in January. So there's going to be a great education center. We're going to have tools so you can go to our website and find out exactly, how do I call my legislator? Well, there's a guide for that. Or how do I write a letter? How do I send an email? How should I prepare for a meeting? So there's going to be some great resources for you there. And we also want to remind everyone that we have our Grassroots Network. As I mentioned at the very beginning, our Grassroots Network in which we send out email alerts, we send updates about current policy issues and opportunities to get involved, and then we'll also be launching a new monthly newsletter in the coming year. So please look out for that, sign up for our Grassroots Network, and that'll be a great way for you to stay up to date, stay involved, and find more opportunities. I can think, we can say this again, and we've said it the whole presentation, but what can you do to engage? Well, first and foremost, encourage everyone to join the Grassroots Network. It's a great way to stay up to date, stay informed, and then you can reach out and introduce yourself to elected officials, even if you don't have a specific ask. Stop by and say, hi, my name is, blah, 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 and here's an issue that's important to me, and it's great to meet you. Or tag them on Facebook, tweet at them, tag them in the Instagrams, send emails and letters. Even if, like I said, it's just to introduce yourself, that's valuable, that puts you on their radar. And then really, finally, to empower all those impacted by cancer. So everyone you know that you think could be really engaged and has a lot of passion about issues impacting those with cancer, get them involved too. Share with them what you're working on. Ask them to join the Grassroots Network and really spread that network so that we can get everybody really passionate and involved. And with that, I think I have come to the end of the presentation. So you'll see my email here as well as Lannia's in case you want to reach out to us with any other questions. Please feel free. But I also want to open it up for questions from anybody listening. So we have a Q&A panel at the bottom where you can type in your question, and I'd be happy to answer, or Lannia, I'm sure, would be happy to answer as well. So please feel free. We'll give it a few minutes and see if anybody has anything they'd like to ask. Okay, everyone, we have our first question. It says, I'm an advocate for lung cancer. What are the best sites to get current statistics from? Really, the best places to get your statistics are from the government or from trusted nonprofit websites. So in terms of lung cancer, I would suggest that you look at the Lung Cancer Alliance or Longevity to see what kinds of statistics they have on their website. Okay, we have another question, very similar. What are some ways to learn more about my state's legislation? This is a really good question, and there are a lot of ways that you can learn more about what's going on, but I think the best resources would first and foremost be the state legislature's website. So every state legislature has a website where they post every bill that's been introduced. You can go back usually something like 20 years. To learn more about the legislation. I would also suggest reaching out to your local CSC or Gilda's Club affiliates to find out if they're engaged or involved in any of those issues. Or lastly, the Comprehensive Cancer Control Coalition really works in every state, and you can get a lot of great information and work with a lot of other organizations that way. Let's see, another question. Do you have any events in the Tampa area? That's a great question. I think off the top of my head, I'm not sure if we have anything going on in Tampa right now, but I would suggest that you first reach out to our cancer support community there in Florida, and then I would also check out our events page on our CSC website, and that's a great way to stay up to date about events, as well as joining that Grassroots network or signing up for our newsletter is also great ways to hear about events. What is the best way to find out what committees/causes your representative or a staffer is involved with? That's a really great question. A lot of times it can be somewhat difficult to find this information, but I would first suggest that you go to the website of your state legislature. Usually they have bios on every member, and you can find out their past, where they used to work, what they're involved in, some of the caucuses that they're on. In terms of staff, those things, since staff tend to sometimes turn over quickly, they're not always as easy to come by. But I would definitely say that, see what you can find on the website, maybe on Facebook, or the best way is just to connect with them. Reach out, introduce yourself, and ask them what they're involved in and share, your concerns and see if that's something that they have experience or they're interested in. Can you send out the websites for updates on state legislation? Yes, absolutely, we will do that after the webinar. Thank you so much. That's a great suggestion. Okay, and then we have one more question. Can we come to DC to meet with our legislator, or is it better to meet in district? This is a really important question. I'm really glad that this was asked. A lot of times I think advocates worry that the only way to be effective is to come to DC and meet with their legislator, and that's absolutely not the case. I would say more often than not it's more effective for you to set up those meetings in district. And the reason for that is that this is the member's home. This is their home community, and they share that with you. You live in their district. So meeting with them in district, first and foremost, you're going to get staffers who are more familiar with the area, more familiar with the issues that affect your specific area. But also, it's just a more comfortable experience to sit down with a member in their hometown and say, hi, I also live in your hometown, and this is an issue that's important to me. So that's, of course, not to knock meeting in DC. That's absolutely valuable. They're both really great opportunities. But I would certainly say that whenever you can meet in district, that's also very valuable and usually a lot easier. You don't have to travel all the way to D.C. to do it. So in district, definitely a great opportunity. Okay, well, I'll give it just one more second, and if we don't have any more questions, I think we will wrap it up. As I mentioned before, please feel free to email myself or Lannia if you have any other questions that you didn't want to share on the webinar today, or any guidance that you might want. We're more than happy to help you out. Okay, well, with that, I think we will call it a day. So thank you, everyone, so much for joining. I really appreciated the opportunity to talk about this with you today, and thank you so much to Lannia for jumping on and sharing with us her experiences. And please, again, feel free to reach out if you have any questions. Join the Grassroots Network, and let's get out there and get excited, get involved. So thank you, and have a great holiday.